Welcome, friends. Welcome to UK Dreamers. Welcome to another warm session with one of the very, very highly esteemed general practitioners in the UK, Dr. Mahibur Rahman, sir, who is going to enlighten us all about the GP training. How do you get into it? How do you prepare for it? What are the GP options you have? And, overall his pearls of wisdom for all the candidates who want to become the general practitioners in the UK. Welcome so much, Dr. Rahman. Dr. Rahman is a portfolio GP. He's a consultant in medical education, and he's going to enlighten us throughout this session.
Thanks very much, Aman, for inviting me, and welcome to everyone that's watching this recording, and especially those of you that are maybe don't know what GP is all about, aren't sure about GP, or maybe you already researched it and are really excited about it, but would like more information about the details of what's the process, how do I get in, what are the exams I need to sit to finish and actually qualify and get my certificate of completion in training, and what are the options afterwards. So, welcome to all of you.
Definitely. Thank you. Thank you so much, Dr. Rahman, for giving your valuable time. So let's proceed ahead straight away. What is GP as a specialty? What would you say about it, sir?
Yeah, it's a great question. So, the specialty of general practice is quite different in different countries. So in the UK, to become a GP, after medical school, you finish at least 2 years of postgraduate training. So this is called a foundation program for UK graduates. They'll normally do that. But for example, doctors that are coming from outside the UK, you'd need 2 years, so internship plus 1 more year, before you're eligible to enter GP training. Then GP training itself is 3 years of structured training. And during that period, you've got to pass your membership exams, membership of the Royal College of General Practitioners, and fulfill various other requirements. Only then you can work as a qualified GP in the UK. So after medical school, it's a minimum of 5 years of training before you become a GP. Now, it's very different to, for example, there are some countries where the title of GP is often anyone that's finished their MBBS, finished their medical degree. After internship, they could sort of set themselves up and see patients, and they'd be called a GP. So that's a very different thing. A GP in the UK is considered a senior doctor, someone who's completed their training, similar to a consultant. The difference is a consultant is someone who's in hospital, a GP is someone who works in the community, but they're a similar level of seniority in that they're a fully trained doctor. They don't have a supervisor anymore. They work independently. And general practice is, the specialty of family medicine, essentially. So we see everyone from babies to, patients in their 90s, and with every condition from mental health to women's health to to musculoskeletal problems, skin conditions, everything in between. Anything can come through the door in my clinic. So that's really GP in a nutshell.
So GP is exciting, what I can sense.
Definitely, it's very exciting. I think both in terms of, it's exciting that day to day, anything can come through your clinic. But it's also exciting in that there's a whole range of options open to someone who's finished their GP training in terms of the different career options and sort of the career that they carve for themselves, because you can use GP as a base, as part of a portfolio career to do lots of other things, but also just once you finish your GP training, there's lots of different ways to be a GP. So you have some people who, for example, will start their own practice or join a practice as a business owner. We call those GP partners. You have some doctors who will work as an employee in someone else's practice, so they're salaried GPs. You have other GPs who will work in different practices, maybe one practice for a couple of days here, one practice to cover someone who's on holiday for 2 weeks there, working as a locum GP. You have people like myself who are portfolio GPs. So that's GPs who've got multiple different roles. So for example, I'm a partner in my own practice. I'm one of 2 sort of senior GPs that are residents at a secure unit for women with significant mental health illness. So they've got a psychiatric team. They look after all of the mental health illnesses. All of these women are significantly unwell with their mental health. A lot of them are detained, i.e. it's a secure unit. They can't just leave without permission. So often they also have physical health needs. And when someone's mental health is not in a great state, they might neglect some of their own physical health. So that's why we have a GP team. So myself and the other GP, we look at things like screening, preventative medicine, dealing with their physical illnesses like their diabetes or their musculoskeletal problems. They're making sure they get their smears, their vaccinations, and things like that. And then I've also cover a community detox unit, and I've held various other clinical roles in the past. So I've done medicals for taxi drivers for the council. I've worked with the army doing medicals for people who are going to enter the army as officers. Worked as a prison GP. Similarly, I've got friends who are portfolio GPs that may be working in a practice for part of the week, but might work in other roles. One who works as a football club doctor, one who works, working as a doctor at events like boxing matches, one who works as a GP with special interest in women's health alongside her regular GP work, and lots of other options. So it is very, very exciting specialty.
So there's a lot of diverse options for if you want to become a GP, what I can get from you, Dr. Rahman. Unfortunately, I think most of us, when I come to the UK, the only perception I had regarding GP is like you sit in the periphery in a room and, you just see patients, you don't do anything exciting. But listening to what you're saying, it definitely sounds quite exciting. So, Dr. Rahman, could you guide all the colleagues watching it worldwide? How can they actually enter into GP training?
Yeah, sure. So if you start with, there's some basic eligibility criteria. So in order for someone to enter GP training, they're going to need 2 years of clinical experience by the start date of the training. So i.e. their internship year and at least 1 more year after internship. As well as that, they're going to need to have full GMC registration and a license to practice. So most doctors will do that by sitting the PLAB exams. But some doctors might already have GMC registration because they've done MRCGP, for example, or some other route. But you must have full GMC registration by the start date of training. You also need to have evidence of foundation competencies. And so this is a series of skills and things that doctors who are in the UK doing the 2-year foundation program, which if you like, it's like an extended internship. Okay, it's a 2-year program. They also need to get these achieved by the end of their program. But doctors applying to enter GP training, if they're applying from outside the UK, they're going to need to get something called the Certificate of Readiness to Enter Specialty Training, the CREST form. And it's basically a whole load of different things, skills, knowledge, expertise that they need to get signed off to show that they've got the equivalent skills and knowledge of a UK doctor who will have finished foundation program. So that's like the basic eligibility criteria. You've got to get those things and then you apply. It's all a national process. So when you apply, you could pick any area that you're willing to work in within the UK, or you could pick them all if you're interested in anywhere. And the whole process, after you meet that basic eligibility criteria, is based on how well you score in assessment. So one of the things about that is really, really fair. It's very objective. So they won't look at your CV at any point. You don't need to prepare a portfolio, unlike some other specialties. Doesn't matter if you haven't done, published lots of papers and things like that. That doesn't make a difference. What matters is how well do you score in the assessments? And currently, the assessment that's used is called the Multi-Specialty Recruitment Assessment, or MSRA for short. So this is an assessment that you can't just sit. It's not like PLAB, which is a standalone exam that you can just sit that, right? You only get an invitation to sit the MSRA after you submit your application for training, and they check that you meet that basic eligibility criteria and that your application has been longlisted, and you get an invitation to book the exam. And that exam has got 2 papers. So one is a clinical paper. So it's assessing, have you got a broad medical knowledge? Okay. So, it tests things like pediatrics, musculoskeletal, respiratory medicine, cardiovascular medicine, urology, women's health, broad-based medical and surgical specialties. But then the other paper is the one that particularly international doctors might be less familiar with. So that's called a situational judgment test. It's the professional dilemma paper. And this type of question, it's not testing clinical knowledge. What it does is it gives you a situation that a junior doctor might face in a hospital or a GP setting. And there might be within that a difficult decision to make, or an ethical dilemma, or a professional situation where there might be different options. And there's different types of questions. So, in one type of question, you rank the options from best to worst. In the other type of option, you pick options that go together to solve the situation, to give the best way to deal with that situation. And both these papers are equally weighted. And, you need to score well in both of them in order to have a chance. And the better you score, the higher you rank. So it's a merit-based system. So, the higher your scores, the higher your rank, the more likely that, one, you'll get a job offer, and two, it will be in one of your top choice places. Because some doctors, if they fail, you can't get an offer at all if you fail the MSRA. But if you pass, but you don't score really well, then you might not get a job. You might not get a job, or you might only get an offer in areas that you're not that interested in. And so you might then not take that job and apply again the following year and work on improving your score. That's like the base way that you get in, basically.
Okay. So Dr. Rahman, you told us the way to get in. How do we prepare for this exam?
Okay, so it's a great question. So because it's testing broad-based medical knowledge in the clinical paper, what you want to do is a combination of reading to cover the material. So you could use things like the Oxford Handbook of Clinical Medicine, the Oxford Handbook of Clinical Specialties. These will cover the knowledge base and at a sort of broad enough level. They're not looking for sort of the level of in-depth knowledge you need to pass membership, for example. Whereas membership is a lot more focused, right? They want to see that you know the detail of one specialty. This is testing all specialties, if you like, you see, because the same exams used not just for GP, but lots of other specialties as well. And so, you want to do reading, but the other thing is that you want to practice questions that are at a suitable level and of a suitable style. And then alongside that, you'll need to read up things like NICE guidelines, because the Oxford handbooks, they're already, some of the guidelines have changed since they were published. So while they're still useful to look at things like how do things present, making diagnosis and things, the management, you need to be a bit more up to date with current guidelines. So, you could read NICE guidelines, or, we've prepared a set of case cards where we've sort of summarized a lot of the guidelines into very, very concise, the key things that you need to know about them. And we sort of update these a couple of times a year. So, like the latest set are just going to be published soon. The 2022 edition will be published very soon. So, we want to do reading and practice questions, do some mock exams. Then for the situational judgment test paper, as well as practicing questions, what you need to do is you need to really understand things like the GMC guidelines, the ethical guidelines that apply in the UK, and how do you actually put them in the context that you might encounter as a junior doctor. So one of the best ways to do that is really to spend time on the wards. And, one of the things I'd recommend to everyone is to try to get some NHS experience before you enter training, because once you enter training, you're going to have a lot of expectations on you. One, that you're already at that level, but assessments start right from, you have like a few days of induction, then straight away you start having workplace-based assessments, even in year one of training. And so if at that time you're also dealing with the fact that a lot of things in the NHS are new to you, you're adjusting to a new country, you're adjusting with things like often people feel a bit homesick when they're in a new place. It can add an additional pressure. Whereas if you spend 6 months to a year already in the NHS, you've already dealt with those sides of things. Now you can just focus on your training, right? So spending time on the wards, you'll find helpful. And then to actually practice questions, we have online revision bank with over 2,100 questions, full mock exams for both the clinical paper and the SJT paper. And what I would say is, please start early, because it's not a simple pass-fail exam. It's competitively ranked. So the better you score, the greater your chance of getting a job, and especially getting a job in the area that you want. So, by starting early, you've got more time to prepare, to both consolidate knowledge by doing your reading, but also to work on your exam technique by practicing questions and doing mock exams. And then, some doctors that want additional support, or if they're applying to really popular areas, really competitive areas, or sometimes people, they've got a partner who's got a good job in one particular area, and so they can only really accept a job within a few geographical areas because they don't really want to move, or their kids are in a good school, or something like that, or applying to a specialty that's really competitive. Then we do also have a 2-day course for the MSRA, which includes the questions afterwards. But at the 2-day course, we have a full day where we can cover key knowledge and guidelines for the clinical paper. We have a full day where we can cover all the GMC guidance, how to approach the different types of SJT question, how to sort of apply them in high yield and high challenge questions and situations. You can ask questions, get them answered live, and then do the questions, the online questions and the mocks afterwards. So that's how people come.
So to my colleagues who just listened to Dr. Rahman regarding the courses, Dr. Rahman is a director at eMedica, in which he teaches us how to prepare for the MSRA and the entire GP exams and everything. I'll give the link in the description below if you want to have further details for it. Thank you, Dr. Rahman. So let's move ahead. Could you give a brief overview about the GP training? You said it's 3 years. So how do the three years, like what the rotations are like, and how does it go like?
Yeah, it's a great question. So GP training, if you're doing it full time, will last 3 years. And in most areas of the UK now, that 3 years will be 2 years in GP and 1 year in hospital. In some places, you'll do 18 months in hospital and 18 months in GP. And some have what are called integrated training programs. So where you'll do 1 year, it'll be sort of hospital based. 1 year, you'll spend half of the week in a GP practice, half of the week in hospital doing different specialties, and then the final year full-time in a GP practice. So essentially, you're going to do somewhere between 18 months and 2 years within a GP setting, and somewhere between 1 year and 18 months in a hospital setting. Now, within the hospital, the rotations that you're going to get, they can be completely different for different people in different deaneries, but also within the same deanery, people will get allocated to different things. But some of the specialties that you might rotate in within the hospital part, you might do pediatrics, you might do obstetrics and gynecology, psychiatry, palliative care, rheumatology or musculoskeletal medicine. You might do emergency medicine. You may do public health. You might actually have sometimes people have, like, say, 4 months or something like that, doing a management and leadership role, learning, the sort of business side of things. A lot of people will have a specialty doing things like general medicine or acute medicine or geriatric medicine, care of the elderly. So there's a variety of different things that you might get in hospital. And because a lot of people now have 2 years in GP and 1 year in hospital, there might be a situation where you don't get exposure to all the specialties and rotations that you would like, that are going to help you be a really good GP when you finish in the hospital part. So that's why one of the things that people can do is they can use things like their study leave. They can use things like, when you're in the GP part of your training, you get half a day every week for what's called self-directed learning. They could use that time, for example, to go and sit in some of the clinics that they're missing. So let's say someone didn't get obstetrics and gynecology. They could maybe, for 6-8 weeks, go once a week for half a day and sit in a clinic with a consultant obstetrician doing sort of a gynecology clinic. They could maybe spend another 6 to 8 weeks going and sitting in a pediatric clinic, maybe if they didn't get a peds rotation. So there's other ways that they can, and they could do courses, conferences, some e-learning, things like that, to get exposure to other rotations. But a big bulk of the learning of GP is going to happen in a GP setting.
Okay.
So that's how the rotations work.
Yeah. So like people have heard about the exams like MRCP, MRCS. Do we have to give a specialty membership exam if you want to become a GP?
Yes, great. So in order to complete GP training, you must pass the 3 parts of MRCGP. Now, unlike a lot of other specialties, you cannot sit any part of MRCGP UK until you're already in GP training. Whereas, like, as you know yourself, you can sit MRCP even before you apply for IMT. You could just sit it separately. MRCGP UK, you cannot do that. There is an exam called MRCGP International that international doctors with enough experience could sit, but that doesn't allow you to enter GP training in the UK. It won't allow you to get GMC registration. It won't allow you to work as a GP in and of itself. So that's really primarily people sit that who want to develop as GPs in South Asia, in places like Dubai. There's an MRCGP International that they recognize in Dubai. But MRCGP UK, which you need to work as a GP in the UK, you cannot sit any of it until you're in training. And there's 3 parts. So there's workplace-based assessments. That's like continuous assessments that happen in all 3 years of training. So, for example, you have to regularly enter clinical case reviews, learning log entries into your e-portfolio. There's certain practical skills that you have to have observed, and they sign off that you're competent in doing them, like doing smears, for example. Someone will observe that you've done so many of them and are competent in doing it. Doing joint injections, things like that, you can learn to do. There's also a certain number of consultations that will be observed. So, for example, your GP trainer will observe, or in hospital, your consultant will watch you interacting with patients and give you feedback so you can improve. So there's a whole load of different assessments that you need to do every sort of year to progress to the next year. So that's called workplace-based assessment. It's not an exam, but it's part of the MRCGP process, okay? It's like continuous assessments that happen in every rotation. Then once you're in year 2 or later of training, you can sit what's called the MRCGP AKT, the Applied Knowledge Test. So this is really testing your ability to apply the core knowledge of GP. So it's a 200-question exam. 80% is clinical medicine relevant to GPs. 10% is about evidence-based practice, so research methods, statistics, graphs and charts, calculations. And 10% is the organizational or administrative part of GP. So practice management, the GP contract, medical legal issues, the different forms and paperwork that we have, duties of a doctor, things like that. And so that's the MRCGP AKT. You cannot sit that in the first year of training. You have to be in at least year 2 of training before you're allowed to attempt that. And then the final year of training, you can sit the MRCGP consulting assessment. So when I trained, and in previous years, this was based on something called the Consulting Skills Assessment, the CSA, where you had 13 consultations with simulated patients. During the pandemic, that's been replaced by the recorded consultation assessment. So currently, in their 3rd year of training, GP trainees will submit 13 recordings of real-life consultations with real patients. So they get consent from the patient, and some of them will be like face-to-face consultations. Some of them might be remote, like we're doing now. We do sometimes remote consultations with patients, and you could record that. Some of them will be, sometimes we do a telephone consultation, and you might record that. And then an examiner will actually observe and mark your history taking, your examination skills. Do you get the right diagnosis? Is the management correct? Your communication and interpersonal skills, all of that will be assessed. But those that are entering GP training now, by the time you sit this final exam, it will change because they're working on a new exam to replace both of those. And it's probably going to take some elements of both. So you'll probably end up submitting some recordings of real consultations, and some of it will be a simulated assessment with, actors pretending to be patients, so they can standardize how do you deal with certain high challenge cases. So you have to pass all 3 of those elements: the workplace-based assessment, the AKT, and the consulting assessment in the last year. You have to pass all of those in order to get MRCGP, the full qualification. And that's a requirement to qualify. You have to do that by the end of your training.
Okay. Thank you. Thank you, Dr. Rahman. So I think we'll proceed to the final section of our recording today. So, Dr. Rahman, why to become a GP? Your pearls of, wisdom for all the candidates who want to, opt in this specialty.
Great. So first thing I'd say is that GP, it has, some wonderful things about it. So things I love about GP, I love the variety. I mentioned earlier the variety in terms of the day-to-day, that each clinic, I don't know what's going to come through the door. Each patient, the next patient, I don't know, it could be anything. So I find that really nice. The variety of options in terms of career path. After you finish GP, there's lots of different options as to how you want to be a GP. You can introduce other things into your career and work as a portfolio GP. Now that is possible with some other specialty, but I'd say with GP, it probably has a lot of flexibility to do that. So I know a lot of GPs who are doing regular GP, maybe, 2 days a week. I know one, for example, then 1 day a week he's doing minor surgery. He does operations. 1 day a week he's doing a skin clinic because he developed additional skills and is a GP with specialist interest in dermatology. You've got additional qualifications in that. And, so some of the week he's doing something different. So there's that variety in terms of the options you've got. One of the beautiful things about GP when you're in your own practice long-term is the continuity. Something wonderful about seeing a patient who maybe, has got some health problems, and you assess them and you deal with them, and they make some changes, and maybe 2-3 years down the line, you've seen that same patient again, and that interaction has had a big impact on their life. Or, sometimes if you've been in a GP practice for a really long time, someone that you treated as a child, and you're seeing them years later when they're applying for university, and, you've seen them in between, and you can see the difference that you've made to their life because you helped them to control their asthma better when they were younger. So that's a really, really nice thing that's really, really satisfying. But what I would say is that if anyone's interested about GP, you must first really be passionate about family medicine. And, you must want to be GP because the work of GP is really hard. it can be really stressful, like any specialty. Because anything can come through the door, you've got to know a little bit about everything, and you've got to stay up to date about a wide spectrum of diseases. And so, that's challenging. So for someone that maybe has never been exposed to GP and isn't sure, go and do a taster day. Come and approach a GP practice and see if you can sit in for a few days and watch what they do, just to get exposure to it. Don't think that I'll do GP because I actually am passionate about something else, but that's challenging to get into. And I think GP will be the easy option. GP is not the easy option. It's not easy to get in. It's not easy to pass the membership exams. It's not easy to be a good GP. The work is really hard. So you have to love it, because if you love it, even though the work is hard, like anything, because you're passionate about it, you're going to thrive. Whereas, if you really want to be a radiologist and you didn't get into radiology, work hard, work on your portfolio, work on preparing for the exams, and you get in next time. Because you've got to think, what do I want to do the next 30, 35 years of my life? You're going to spend a long time at work. You're going to spend a long part of your adult life in that role. You've got to love it. If you don't love it, then, any specialty, you're going to be miserable in it, aren't you? So that's what I would say, is that, it's a wonderful specialty for someone that loves family medicine. For someone that isn't passionate about GP and about family medicine and sort of thinks, I'll do it because I've heard that it's a short training, you're really going to be miserable. And a lot of those doctors, they end up, once they see how hard the work is, they end up leaving because they're not passionate about it and going back to what they actually wanted to do, which was in hospital. So I hope that helps.
Surely. Thank you. Thank you so much, Dr. Rahman. That was indeed an enlightening experience. So for all of the colleagues wanting to become general practitioners, you can follow Dr. Mahibur Rahman, sir. He's on Facebook. He's all on the social media platforms, and he's got his website of eMedica. And thank you so much, sir. You've actually, changed the lives of so many doctors, and definitely you would be keeping on changing that in the future as well.
Thank you so much.
Thank you so much for your valuable time. Thank you so much, guys. Do share it with your friends who want to become general practitioners in the UK. Thank you so much.
Thank you so much. And thanks for inviting me.
Thank you. Thank you, sir. Bye-bye.